This is Miss Yeomans recording for Clinical 1 for the physical exam first lecture. This will be broken down into 20-minute intervals and we'll try to get through this quickly. Again, this is for the physical exam chapter. So if you will turn into your textbooks to the beginning of this chapter. The textbook that I'm using now is Chapter 5. You might have a different version. You will notice that at the very beginning of the chapter, as there has been in each one, there are a list of definitions and terms. You need to be familiar with those and be able to identify those. The big thing here for this chapter is the different types of diagnoses. You've got the final diagnosis, which obviously is the final determination of what's going on with your patient, but you also have some different diagnoses such as the clinical, differential, and that's really important that you understand that those are not the final diagnosis, nor is the prognosis. So let's go ahead and start the chapter by talking about what is a complete physical exam and what does it include. Well, as you can see here, the physical exam actually includes very, very, very important things. So I'm going to try to get back to the beginning on the screen. I'm sorry, I did not do well with going through slides. I will try to stay up to date as much as I can, but let's look at why we have a physical exam and what is involved with the physical exam. It consists of three very important things: the health history, the physical exam itself, and laboratory and diagnostic test. So those three things are what compose a complete physical exam. Okay, so now you ask, why would someone need to have a physical exam? What are some of the reasons why people have those? Well, of course, we try to do that for detection of early illnesses such as heart disease. If you're looking for chronic illnesses even, we look for those because the sooner we can get a hold of those, the easier it is to treat them and try to keep them at bay. But here's some other reasons why people might need to have a physical exam. Prerequisites for employment, we often call those pre-employment. Participation in sports, those are sports physicals that we do every year, so the kids in the area can participate in those sports activities. Even for summer camps and admissions to schools, our four-year institutions require that the new students have a complete physical exam and even some lab work that needs to be done. So what do we do once we have that physical exam conducted? How does it get a final diagnosis, or if you will, what's the outcome of that? So the provider, whether it be a physician, a nurse practitioner, or a physician assistant, they are going to actually look at all the results that we gather, all the things that they see during their part of the exam in order to arrive at a diagnosis, whether it's for a sports physical or if it's for an annual physical or if it is for an illness. They have to look at the entire picture in order to come to a conclusion for any type of diagnosis. So that would be where they come to the final diagnosis. All right, so I'm going to skip past these definition of terms. You're going to have to learn those and look at those. I'm not going to read them straight to you. It's just not who I am, not how I work. But let's talk about how we're supposed to prepare the exam room, not only for the physician, but most importantly for you and your patient. So you have to think about getting a mental picture of walking into an exam room. How should it look? How should it be prepared? You want to ensure several things. If you look in your textbook, there are about 14 things that they list there for us to do in order to get the room prepared for the exam. And as you look through each of those different things they have listed, It's important that you have a good appearance in your exam room, so when your patient walks in, you're bringing them into the exam room, they see a very well organized and clean environment. That lets them know right away that you are going to be able to provide them with the best quality care, not quantity, but quality, and that's what we're looking at. Waste baskets, i.e. trash cans, they need to be emptied. They don't need to be overflowing. It's crazy enough that some people do leave those trash cans full. Another thing that you might want to keep in mind is this. No matter where you work, what specialty you work in, you will probably have a parent bring in a young child that is still wearing diapers or pull-ups. And oftentimes when we're not in the exam room, they will change those diapers. And guess where they get thrown? Not in the diaper bag, but in our trash can. If you leave a dirty diaper in a trash can, it will stink up your whole exam room, and it eventually will go down the hallway. So, just remind your parents that they throw away a dirty diaper while they're in the room, just to let you know, so you can change that out after they leave the exam room. Okay, we want to make sure that the table has clean paper on it. It has been cleaned and disinfected. The actual countertops are all disinfected. And let me remind you of that chair that's in the exam room. Make sure you clean that chair with the disinfectant wipes. The door and the doorknob, everybody's touching that, even the light switch. Those frequently touched areas must be cleaned. That's really, really, really important. Another thing we have to think about is dust and dirt that are in the room. Now, I'm going to be honest with you, that's not at the priority of between every patient to be looking for that or to see it, but you can pick up on who has tracked in mud and dirt on their shoes. Get you a little dustpan and broom and sweep that up. If there's more intense cleaning that needs to be done, then you might need to close that room down, or maybe you need to let your housekeeping staff, or what we called our clean team, let them know that you need some help getting things cleaned up. Make sure that you have enough supplies in your room, such as not just the things that you're going to be using during the procedure, but I'm talking about gowns, drapes, and towels. Those are very important. They're also very hard to come by in the clinic if you work with a large group, because everybody has to share. Okay, we talked about how all of our stuff needs to be clean. If you can remember back from the earlier part of this chapter, the difference between decontamination, disinfection, sterilization. Make sure you don't sterilize those instruments that can be damaged, but you do want to make sure everything's clean. All right. Making sure that your equipment works and is in proper order before you open that room up to be used that day is very important. It's very, very embarrassing when you have instrumentation hanging on the wall like an otoscope or an ophthalmoscope, and your physician goes to use it, or maybe you use it, and it doesn't work. It does make you a little embarrassed. You don't want to be in a room when your stuff doesn't work for you. Okay? And have everything ready. So in your textbook, you can actually see this same picture here, the preparation for the exam room, the typical equipment that you will need for your exam room. I will tell you right away that the percussion hammer is one that you will need. Tongue blades, which are called tongue depressors. Otoscope and ophthalmoscopes, these are typically hanging on the wall, so you don't have to worry about the ones that the doctor can put in his pocket, except for if you have that doctor that wants to use his stuff. Make sure that you have backup batteries as well as light bulbs to go inside here, because when those instruments start failing on you, it is hard to keep the flow of your clinic going, because your doctor's going to get a little frustrated. So Those are your typical pieces of equipment that you would have in your exam room for the physician if the patient is having a complete physical exam. Now you might be thinking, well, last time I went to the doctor's office, I sure didn't have all that stuff in my exam room, or thank goodness they didn't have to use all that on me. And that's right. You probably did not have to have all of these pieces of equipment used, but depending on what your doctor likes to have in the exam room, set up your exam room to where you can get to those supplies easily. What we say is easily accessible. Make sure those are stocked before you start clinic in the morning, or before you go home that afternoon. Make sure your rooms are ready for the next day. So, what is our responsibility during the exam? Well, this case we're looking at the preparation. After we greet the patient in the reception area or the lobby, we want to make sure that we did call back the correct patient. I promise you, there are going to be times when you have 2 or 3 people stand up because they thought you called their name. But it is extremely important, just as with anything else we teach you in this program, you have to identify your patient. So what are you going to do? You're going to definitely identify your patient by asking them to state their full name and their date of birth. Now, don't say, are you Jane Doe, birthday 1/23/60? No, you want them to tell you what their information is. And then look at your chart to see if you have the right person. A lot of times now with the electronic records, you actually have a picture to refer to for your patient. So I like to cheat a little bit, if you will. Whenever I go to call a patient out of the lobby, I like to look at their picture first, maybe on their driver's license. It might not be the most up-to-date picture, but it at least gives me something to go by. So when I open that door, I can use my eyes to scan the lobby, call that patient back, and they know that I'm talking to them. Okay? So those are some really big things, all right? Another thing that you want to do is ask the patient if they would like to use the restroom to empty their bladder. It is extremely important that if you need a urine specimen, that you let them know at that point, I need to get a urine specimen from you. I need you to go to the restroom and empty your bladder. But if you don't need one, that's okay. Still ask them if they need to use the restroom. When they have an empty bladder, it makes that exam a whole lot easier and more comfortable for them. Okay? So then you can move into doing what we normally expect to do. Assessing their vital signs, measuring their height and weight. There's a term that you need to be familiar with that's in your textbook. It's called mensuration, mensuration. What this typically means is you're just basically measuring the weight and the height of your patient. Okay, so mensuration, that's a new word that we need to know. All right, so we've addressed who they are, we've got them in the back, we've got the right person, we're getting their vital signs, we're measuring their height and weight. Then we need to move into asking them why they're there, or at least saying, well, it looks like you're here for your annual exam. Is that correct? Maybe they're there for a problem. So this is when we become the sleuth. We have to start asking questions. We need to know what is going on with our patient and why they're there. Okay? So here on this slide it says the apprehension can be reduced by addressing the patient by their name of choice, having a friendly and supportive attitude, and speaking clearly, distinctly, and slowly. Y'all know we don't have too much trouble with people speaking slowly here in the South, but there are a lot of people that speak very quickly. So don't be don't be so slow that people think that you are making fun of them. Just be slow enough that people can understand you. Enunciate properly. Use proper grammar in English. You are not at the disco. You are at the office. This is a professional environment. So remember those things when you're talking to your patients, okay? There's the slide talking about voiding. You know that's important on my mind, isn't it? And then we've got to get that patient ready for their exam after we do our screening process. So depending on what kind of exam they need will depend on how much they need to disrobe. But it is extremely important, if your physician wants that patient in a gown no matter what, then put them in that gown and have them ready for him when he comes in. The other thing we need to remember is if we're going to ask a patient to get into a gown, then we need to remember to provide them with a drape of some sort, okay? So that has to be done. All right. Now, let's see. Disrobing, the facility should be comfortable and private. They shouldn't feel like they're disrobing out in the lobby. All right. So, what do we do now? Let me back up just a moment and go back to mensuration. I apologize. Go back to mensuration for just a moment. I want to point out a few things for you. When we're talking about adults and we're bringing them in for annual exams or any kind of exam, we actually acquire the height and weight on a patient, an adult patient, every time they come in. Children are weighed and their height and weight is measured during each office visit. And the reason that we're doing that with them as well is we're looking to make sure that their growth patterns are continuing to improve, as well as we're making sure that we get their proper weight in order to calculate medication dosages. It is extremely important that you remember that. Children must be weighed. We've got to make sure that they're growing properly, they're not slowing down, and whenever we go to prescribe a medication that we give them the correct dose. Okay? So now moving forward, I apologize for backing up. So let's look at, if you look in your textbook at the procedures for weighing a patient, this is not a very difficult procedure. It's actually very easy. It just looks intimidating because there's this big, loud, noisy instrument that is going to be intimidating to you. But what we're going to do, the base of the scale, which is called the platform, this is the part where the patient steps up and stands. Now keep in mind, most manual scales, that platform is very small and it wiggles around. So be sure to support your patient, hold their hand, put your hand behind their back, and support them as they're stepping up on this platform, because they can really get off balance and feel very scared or even fall. So just be mindful of that. Also, you definitely want to make sure that your patients that are elder, pregnant, and morbidly obese, that those patients have maybe a bar or a handle to hold on to when getting off and onto that scale, because they're going to be the ones that are most prone to fall or stumble. Okay, so let's look at, that's talking about body mass index, and here we go, measuring height and weight. We're going to balance our scale before we use our scale at any time. So if you look at the picture here of this old balanced scale, old school scale, when we say that the scale is balanced, if you look over here to the far right end, this little knob that sticks out is actually protruding through a square here. And we want that knob to hit right in the middle to show that the scale is balanced. If it is not balanced and both of these different weights are not all the way to the left. That's all the way to the left on the scale. Then this little portion here is going to be all the way up or all the way down. So we want to make sure that these are all the way over to the left on 0. If that is still not balanced, then what we can do is use a screwdriver here on the very end to twist either righty-tighty or lefty-loosey, and that will help to get us balanced again. So basically what you need to understand is once that patient steps up on the scale, you're going to begin by moving this bottom weight. And it is actually calibrated into measurements of 50-pound increments. So it's on 0, so the next one that it's going to go to is 50. Then here you see 100, 150, 200, and so on. Then you would actually come up here to the top bar where you have your single pound increments that are actually going to be in quarter pounds. And what we want to do is we want to get this top bar and bottom bar balanced over here on the far right to the nearest quarter pound. To the nearest quarter pound. That's going to be really important that you remember. Alright? And it's not difficult, it's not hard. Please don't get frustrated with this. We will have plenty of time to look at this. But I did want to show you this picture, and this is in your textbook as well. If you look at this line here, the big long lines here are the single digits. So you have 12, then this is 13, and then this is 14, and then each little line after that we're looking at a quarter of a pound. Remember, there's 4 quarters in $1. So there would be 14, 1/4, a half, 3/4, and then 15. So that's not hard to figure out. Don't let that bother you. Now, looking at weight, you are going to be asked by your physician to give the weight in pounds, and then also may be asked to figure out the weight in kilograms. So if you have the pounds of a patient, or the weight of the patient in pounds, and you want to take it into kilograms, what you're going to do is you're going to divide the number of pounds by 2.2, and that will give you the kilograms. Alright, and then if you wanted to go from kilograms back to pounds, then you would actually multiply by 2.2. Okay, so the big thing you need to remember is take your measurement of weight in pounds and divide it by 2.2 to get the weight in kilograms. Alright, some of you guys already know that, but for those of you that don't, that's okay. Now you know it. Alright, so let's look at the height. And height is actually referring to how tall someone is. And we have to measure the height with a measuring device that's like a like the balanced weight, but it goes vertically, and it is actually measured in inches. So if you see here, you have inches, and then you also have the quarter inches. So don't let this scare you. The meter device actually has that pre-marked for you. All you have to do is to go at that little portion that sticks out to rest on the top of the patient's head and the patient looking forward, and then you'll be able to measure their height. That's not very difficult at all. And you can see in your textbook it walks you through a procedure of measuring height and weight, and that just makes it a little bit easier for you as well. There's also videos on the Elsevier website that walk you through measuring height and weight, as well as some activities that will actually show you how you're doing with your weight.